Hello, everybody. Welcome to our Sunday Zoom class. Usually I say Friday because I teach every Friday, but here we are on Sunday. This is a specialty class. I've had one other person say they're hopping on right now. So that's Jenny Garcia. Welcome. Let me organize a few things here and then we'll get started. So today's class, again, it is Sunday. This is a special class because we are coming off the heels of oil studies. If you don't know what that is, it is a program that us builders use to attract new people and put new people in, and they give us their opinions on some of the products that we share with them. Three of the categories that we cover are pain, stress, and what's the other one, Wendy?
Digestive.
Yes. So in January, we had the study. February, there's going to be a new study available to drop people into. And what we found was that pain was a big subject, right? Everybody suffers from pain, and our products in doTERRA help people manage their pain, eliminate their pain, and gain a different viewpoint on their pain. So this is one of my favorite subjects because I specialize in pain management. As a clinical massage therapist and a certified labor doula, I use doTERRA to help clients deal with pain. Not only deal with it, but actually face it head on. Because sometimes there's no getting away from it. We need to go through it. We need to help our bodies heal from it and come out on the other side stronger. So I hope you know what I mean when I'm talking about that. I would love for you to participate in this class today. If you feel like you need to make a comment about something that I'm saying, please interrupt me. I don't really mind that at all. If you have a question, drop that in the chat. We'll circle back around and answer those. And if you use that reactions button on the bottom of your page to throw up an emoji every once in a while, you could participate in that way as well. So, what is pain? What is pain's secret message to the body? One of my favorite things to do with my clients is to simply help them expand their viewpoint about pain and help them see pain as a messenger, right? It's our body talking to us. So the bottom line is that pain is something that people just hate to deal with in life. Generally, the first response that people take when they suffer from pain is, please make it go away as fast as possible, right? And then people rely on interventions such as drugs, injections, surgeries, and bad lifestyle habits to simply distract them or to literally help them take the pain away, right? But what if that actually was cheating us of valuable knowledge that could help us actually heal the pain, get down to the root cause of the pain? So a key question would be, what if pain was giving us valuable information that could help us heal? Would you just want it to be gone, or would you want to know, to investigate, to find out what's really going on so you can get to the bottom of the matter? So I'm going to introduce you to a pain principle. Pain, how is it spelled? P-A-I-N, right? Remember those letters. When we experience pain, there's a process that will help us to get this information. By using this pain principle, you can go deeper in understanding why you're experiencing the pain right now so that you can make the right decision in order to help your body. So pain means pay attention inside now. So you see, those words are very specific. It means that we need to slow down. We need to pay attention We need to go inside, not always be outside, right? And we need to do it now. Pain is our body's signal that something we are doing isn't working right. For example, if you get a small muscle ache in your back, but you just ignore it, it might come back even worse, right? And then what if you take some painkillers to numb the pain or ignore it? It can go away for a little while, but it's going to come back. And I like to say that pain, when you first experience pain, it's just like your body's whispering to you. So do you hear those whispers? Or are you going to just ignore it until your body's actually screaming at you and it says, stop? We're not going any further until we address this matter, right? So what if you just had, I don't know whose volume that is, but girls, I guess you could figure that out. But what if you just decided to listen to your body in the first place when your muscles ached and you did something about it rather than ignoring it? Perhaps you stretched more, you did some exercises, you went and got an adjustment, you lost a few pounds, you applied essential oils or took supplements and it helped, right? Our body is constantly needing support in different ways. So the next time you have pain, use that principle to gain insight into what your body is telling you. Likely it's trying to tell you something needs to be changed or needs to be supported. And so now I'm going to go ahead and share my screen and get my slides started because I think you're really going to love what I'm going to show you next. So Yvette, can you see these slides?
Yes.
Okay, cool. Thank you. So this presentation is just one part of a wellness education series. There's 8 classes available for you to watch with different people teaching them. This is my favorite in all of the classes that are offered. Hold on just a second. I have to make it to where it will go as a slideshow. So who here suffers from pain? Drop that in the chat. What kind of pain are you going through right now? Because most likely you will learn something from these next couple of slides. Let's see if we can figure this out. Hold on. Okay, so I'm just going to have to scroll up instead of click the button for the next slide. So essential oils and pain, okay? We all suffer from many pain. In fact, yesterday I was at an event all day long and I woke up this morning in pain. Now, when I came home, I did an oil treatment, took a hot bath. My husband rubbed my feet for a little while and I had a good night's sleep, but I still woke up a little swollen, a little sore. And so I took more Deep Blue polyphenol, I put on more oils, and I decided to just stay indoors. You see, I was around people all day long yesterday, and it was a great event, but it was a little draining. And so my personal protection plan sometimes is just to hibernate and be alone in my own home so that I could minimize any type of inflammatory response that I know is going to happen. Sometimes if I keep going and going and going and I never stop and take a break, then my body doesn't have the time to heal. So we're going to start here with a little test. I would love each of you to get a baseline knowledge of where your pain level is. And we're going to mention 3 categories: chronic pain, emotional pain, and occasional pain. Yvette, does the screen look okay? Can you see the slides okay, honey?
I mean, I could see it.
Okay, great. Okay, so again, chronic pain, emotional pain, and occasional pain. So on a scale of 1 to 10, rate your pain, 1 being very low, 10 being the highest, right? Chronic pain it's a part of my everyday life. I know some of you here have chronic pain. I have chronic pain in my right hand, my wrist, because of my massage therapy work. So if I don't take care of it, it can get really, really bad to the point where I can't sleep. But after I work at my office and I do my massage clients, I come home and I ice it and I massage it and I put oils on it and I do my exercises and it helps. Then there's emotional pain, which is the heaviest of all. That's very, very real, especially post-COVID. Many of us lost friends and family, right? That's not the kind of pain that goes away quickly, not like a physical pain. And then we have occasional pain, which is I have good days and I have bad days, okay? So here in doTERRA, we take a holistic approach to health, which means we understand that every body system works together. The modern healthcare system addresses singular systems and focuses on that. But here in doTERRA, we like to focus on a more holistic style of healthcare. So we ask the question, which body systems, see the S, which body systems need the most support? If you're going to be focusing on immune support, please know that it does affect your cardiovascular health and other areas, right? And so creating foundational support is important for overall health for all systems. And that's why the first product we're going to talk about is our Lifelong Vitality. Most of us here are familiar with it, right? The Lifelong Vitality forms a good foundation to build upon. And it falls into the bottom category of our wellness lifestyle pyramid, nutrition and digestion. It helps with both of those. It'll help you take in good things and it will help your body eliminate bad things. So remember, everything we eat either feeds disease or fights disease. So think about improving your diet to help you manage pain. There are inflammatory foods and there are inflammatory diet fads that people follow that actually increases their pain, and they really don't understand that. So Lifelong Vitality is, again, foundational support. If you're not already on it, I encourage you to give it a try, even for a month. It comes with a full money-back guarantee if you do not see improvement. One thing that I experienced when I took the Lifelong Vitality is less pain and more energy. So I highly recommend that product. Now, the Lifelong Vitality helps in all three of those categories that we talked about. Remember, chronic pain, emotional pain, and occasional pain. And this is the slide that tells you how. When it comes to chronic pain, our vitamins provide healthy responses to oxidative stress. They give our bones calcium, magnesium, zinc, and vitamin D. And they help support healthy joint function. When it comes to emotional support, many of us here have felt that mental clarity, that ability to make better decisions, right? Because of the wide range of omega-3 fatty acids. It helps the gut and the brain at the same time. When it comes to occasional pain, Lifelong Vitality provides a foundational support of vitamins and minerals to fill in those gaps in our diet. And it provides optimal nutrition that protects your body and speeds up recovery. So we want definitely to be taking Lifelong Vitality as a first defense against pain. So we can't really have a conversation about pain and ignore the dangers of prescription pain medication, right? Have you ever known somebody who is addicted? There's so many people out there. And sometimes it happens very, very easily, right? But there is an opiate epidemic taking place in this country. And so here's a few statistics. Pain medication causes more death than accidents. They are considered safe, especially by teenagers, because they were prescribed by a doctor and technically they're legal. But they do give a false sense of euphoria. And it can quickly lead to addiction. And doctors will tell you this. They'll have an open conversation. That's why they only prescribe 7 pills post-surgery, because they don't want you on the pain medication for longer than that. There are horrible withdrawal symptoms when people want to get off pain medication. They're overprescribed. It says an estimated 90% of people with chronic pain are prescribed opioids, which is medication specifically designed for short-term solutions, even despite evidence indicating that non-drug treatments may provide relief with less risk. And of course, you understand that they cause so many digestive issues. Your digestive system slowly shuts down. So there is overwhelming evidence that natural treatments are effective and safe. And that's why I love talking to people about this. Now, here's a few tips for weaning off pain medication. You want to increase your water intake. Always, always, always be carrying some kind of container with water in it. It will help if you add electrolytes to it, and doTERRA is coming out with electrolytes in February, so watch for that. Replace the bad habit. So just quitting isn't going to work. You have to actually do something else instead of taking the pain medication. Take Lifelong Vitality and additional supplements. I've helped many people get off of pain medication with doTERRA products. It is possible. And then I think the most important thing there is that we surround ourselves with proper support, right? Make sure you have people that are cheering you on. It makes the biggest difference in the world. Manifest what you're doing and draw the right people to you so that you can make progress and switch from like prescription drugs to more natural remedies. Now, sometimes people actually can't get off it for whatever reason. Maybe they can titrate down on the dosage. That has happened, and people are so much more better off in that way as well. So keep that in mind, okay? Now, the number one way that I love to help people manage their pain is through this aroma touch technique. I have been helping people with this technique for the last, I would say, 10 years. Previous to that, I was at the chiropractor's office with different oils, and they weren't producing the results that we get with these aroma touch techniques. So if you know this technique, drop a number 2 in the chat. If you don't, then you can actually go to training.doterra.com and take a course. There's a wonderful, easy course to follow with videos from Dr. Hill that explain each oil and why each oil was picked and how you layer them on the spine and how they work in the body. Most of us have these oils here, right? Most of these oils come in our starter packets, except for, I think, Balance and Aroma Touch. Now, we do have an Aroma Touch kit that you can start out with. It is an aroma kit. It comes, the course is free when you buy that kit, and it comes with the fractionated coconut oil and the pump, so that's great. But you start off with Balance and lavender. Those 2 oils together are pretty powerful. They calm the nervous system down. And then when you think about applying the oils to the spine in a beautiful atmosphere and you help the person smell, adding that compassionate touch to their back, creates such a relaxing moment. So Balance and lavender, addressing the nervous system. Then the next 2 oils are Melaleuca and On Guard. And those oils help the body with proper immune boosting function. So nervous system, then immune system. And then the next two oils are Aroma Touch and Deep Blue. And those help the body create healthy inflammatory reactions. So any kind of inflammation is going to be brought down. And the last two oils, wild orange and peppermint, just help the body come into homeostasis. So when I get an Aroma Touch, most of the times I end up tired and I go to sleep. But some people, when they get an Aroma Touch technique, feel energized and they get up off the table and they're like, ooh, I can go clean the house now. Is there anybody here who wants to give a testimonial about an Aroma Touch technique that they received? Just unmute yourself. I see the chat exploding, so I'm happy that you guys are dropping comments there. Anybody want to share?
I have a question. Does the feet part count?
Yes, yes. The feet are
Because
included in the Aroma Touch.
you did that for me. Remember when you came down to visit us last year? And I have to give my experience because my husband couldn't believe it either. Because we were doing classes and we were doing our business classes and so you're overwhelmed and so much going on. And I remember that you said, well, let me give you one. I'm gonna give you on your feet. Well, right after that, I went home, which is normally when I do things at home, like house cleaning, whatever, I can't do it all in one day because of my, my joints and stuff. But I was like full of energy and nothing really hurt me. I did the bathroom, I did the living room. I was doing so many things in one shot that I told my husband, I don't know, but I feel like empowered right now. So it really does, especially the combination of the oils, like the layering that you explained about how it does help different parts of our systems that I'm not saying that, it can work that way for everyone because everyone has a different effect, but you are going to feel some relief for sure. So that's my
Awesome.
experience.
Thank you so much for sharing, Yvette. I remember that experience now. So I love this technique so much that these bottles are all on my nightstand and they each have a Doppler on top. And I usually give my husband an Aroma Touch technique at least once a week, and then he does me. Um, it's just it's just an amazing technique. So try it out, do some more research. It is one way to help with pain, and you do not have to have a certificate for massage therapy in order to do it. In fact, I do this Aroma Touch technique on myself personally, just on my shoulders. And if my knee is hurting, I'll layer all those oils on my knee and I will feel relief. So it is a pretty powerful protocol. Now, for those of you who are a little bit more experienced with essential oils, or perhaps you've heard of Symphony of the Cells protocols, take a picture of this screen because this is another very powerful essential oil application. You have frankincense, melaleuca, wintergreen, or birch. Now we have birch as a permanent oil, right? Massage blend, which is Aroma Touch, lemongrass, white fir, but we use Siberian fir, helichrysum soothing blend, which is deep blue, and peppermint. So think about RA, any type of arthritic issues. This is an amazing protocol to do as well, but very, very strong. So people who are not experienced with oils, if you do this on them, they will have somewhat of a detox. The Aroma Touch technique is very, very gentle. It's great for children. This one might be hot for children because it includes that birch or wintergreen and the deep blue, right? So do consider those things, but know that you have these two protocols to use, okay? Now, we mentioned the lifelong vitality as foundational health, right? We're going to jump into 5 different categories on which you could add other products to build on top of that. Okay, so we're going to talk about joint pain, muscle pain, emotional pain, digestive pain, and head tension. You'll notice that some of these products overlap into different categories. For instance, the copaiba can be taken in three or four of those different categories, right? Turmeric is another one that doubles up for joint pain and muscle pain, and we'll get into some of that information. So here we're going to talk about joint pain. Does anybody have joint pain here? I can't see everybody because the Zoom is closed, but I'm sure some of you are raising your hand. 3 products that you could add on top of Lifelong Vitality are the turmeric soft complex capsules, the deep blue rub, and the deep blue polyphenols. So, as you know, our turmeric capsules are like nothing else on the market. All the turmeric on the market are sold as 2 separate things, the turmerones or the curcumin, but doTERRA has blended them both, right? So this is pretty powerful for joint pain. And joint pain is like really deep, can be affected by weather or posture or shoes. So consider other things that you might need to look at or change in order to help joint pain, okay? Now, when it comes to deep blue, it shows the rub there, but most of us already know that you also can use the stick, which has the copaiba in it. This product is labeled an analgesic, so it can replace many of the over-the-counter drugs that people use, topical ointments like Bengay and things for pain. This one's wonderful. And then the deep blue polyphenol capsules. What can we say about those? Anyone want to share some knowledge that they have about this beautiful product?
I'll share.
Go ahead.
So, my husband had a knee injury, excuse me, some years ago from basketball, torn meniscus, and he no longer has an ACL. And so he was doing Aleve. This is before doTERRA. He'd been doing Aleve every day. And then obviously doTERRA came along, and I'm like, switch it out. This is a ditch and switch. And he said he found he had the same relief from the deep blue polyphenols as he was getting from the Aleve. Obviously, the difference is it wasn't messing with his gut. And they're good overall good for him. And because they're based upon essential oils, and he was doing deep blue topically, sorry, too, I should have added that in. It started repairing the injury. So then it got to the point where it wasn't even every day he was doing the protocol anymore. It was kind of as needed. So it's really cool.
Oh, we love those kinds of stories. That's great. I'm glad to hear that he's feeling better and he was able to get off of Aleve. Yvette, you have your hand up?
Well, my mom said she'll give a 10-second, 5-second,
In 2 seconds.
2-second. Go ahead, Mom.
No, I was gonna say something about the deep blue, the pills. The capsule, that's what it's called.
Mm-hmm.
And I've been taking most of the time because it helped me for my inflammations. And I use the deep blue and what is that, cream? Yeah. And I feel much better when I have a sore body like that. Just take it at nighttime, and the next day I feel okay.
Yay!
I've been taking that for a long time anyway.
Very good. Well, there is no need to stop taking it. Thank you so much for sharing. Thank you very much. So joint pain is manageable, and we can eliminate and ditch and switch some of the over-the-counter drugs that we buy or that people use and switch over to something more helpful, right? So that's joint pain. Let's now talk about muscle pain, which is kind of like above joints, right? Joint is kind of deep, muscle is top layer, soft tissue. Pain, and that could be anywhere on the body from head to toe, right? You'll see the turmeric soft gels there or capsules, the copaiba. These are like amazing. Now I take 2 drops of copaiba every morning, every night for inflammatory reasons. But lately, like the last month, my lower back has been pretty sore at like 3 o'clock. something triggers in my body, and it's the left side of my sacrum. And I take 2 Copaiba and 2 Deep Blue Polyphenol as soon as it comes on. And I kid you not, within 20 minutes, 15 to 20 minutes, I can feel a difference. And so I was like, oh, I think I struck gold. I have a solution for people. Because you recommend this stuff, but sometimes you have to experience it over and over again to build your belief and solidify your deep belief in it, right? So 2 and 2 is my secret recipe for pain that isn't going away. I think the inflammation goes down right away. And then since it's going into evening time, it helps that I could rest. Now, that oil marjoram is wonderful for pain. It is a spice, but a lot of people don't know that it's great for pain. Do we have anybody who uses marjoram for pain here? Well, I bet you're going to start using it now, right? I was going to look it up really quick in the Essential Life Book app on my phone, but I have to update that. So marjoram is pretty powerful. My mother uses it on her knees. She has had 2 knee replacements. She cycles through different oils because she finds that her body kind of gets immune to it. But every time she uses marjoram and arbor vitae for pain, you can smell the scent coming out of her room, even with the door closed. It's that powerful. So don't forget about using marjoram for muscle pain, topical muscle pain. A Deep Blue rub is there again. I have to tell you that that oil comes in a very large container. And when I found that out, I had to buy one just for my home, because between me, my husband, and my 2 teenage boys that are very active outside, we were always running through that little bottle of Deep Blue rub there. But now I have it stationed downstairs with all of my oils, and that's exactly where they go for a little pump of Deep Blue, and then they just put it on them wherever they're sore. So highly recommend these products for muscle pain. All right, let's move on to talking about emotional pain. So I know that many of us here use the Adaptive Collection. It is an amazing product to help with emotional pain. It comes with 3 items: the 15 ml that could be used in the diffuser very easily, the 10 ml roller, that's a personal product and you just roll it on. I carry those in my purse. But recently I have had to carry the capsules in my purse as well, because when I take 2 adaptive capsules, I literally feel like I'm shifting down in gears, and I'm able to think clearly and make better decisions. I have more patience, which is very important, right? I take care of my senior citizen mother in my home, and I love her to death. But sometimes life is challenging, right? I can say that adaptive soft gels have saved my marriage, because in the heat of an argument, you don't think right. You say, things that you're gonna regret, but it just comes out and you can't control yourself. And oftentimes when that happens, I'll go take a couple of soft gels and I'll just do some breathing, say a prayer, and I'm able to come back to the situation with much more control. And so I highly recommend Adaptive to anyone who is suffering with depression or any kind of emotional pain that's much more difficult than physical pain, right? Of course, we have our whole emotional aromatherapy line, and I put peace on this slide because it is called the Reassuring Blend. It smells amazing. I should have added console to this slide as well, because that's called the Comforting Blend. And when you lose a loved one in death, that oil will definitely help you process grief. Do we have any experiences with those emotional aromatherapy oils that anybody would like to share for dealing with emotional pain?
I can share.
Okay.
I honestly, so I don't like the smell of all of the oils. Right? So Console is one of those blends that there's something about the aroma that I'm not fond of. However, it just shows you how powerful and amazing they are for us, because with Console, I have a roller, and if I feel emotionally overwhelmed and my chest is tight, I put it over my heart, and it's like almost instant. And I do some breathing with it too, but it really helps a lot. And I deal with the aroma. Now somebody else might like it, might love it, but it helps. It's amazing.
I love that experience because you're bringing forth the thought about using the oils for the function and not the likability of the scent, right? A lot of people don't use the oils that they don't like the smell of, but they need to use it for a reason. And so you were able to look over the smell, but use it because you knew it was going to help you in that moment. And so that's pretty powerful. Love it. So you see a diffuser there. When we're experiencing emotional pain, it is helpful to have a diffuser going constantly to help lift our mood, to help us think clearly, to help us deal with the circumstances that we're facing. Yesterday at my Reclaim Your Health event, we had a Shinrin Yoku room. And it was a pretty small space with a couch, a table, 5 chairs, and they had 4 diffusers going on in that room. And when you opened the door and you walked in, oh my goodness, you just felt like you were in the forest. It was so beautiful. And I came home and I thought, I don't have enough diffusers. Like I have 1 in the living room, but I was like, I'm going to put more diffusers out and get this stuff, pump it through the air, because it was just so relaxing. It was a place for everybody to go relax during the event if you felt like you needed to decompress a little bit, and it worked out wonderful. And then, of course, the last product we have here is the king of all oils, frankincense. So you could use this one all 3 ways: aromatically, topically, internally. There are sedative properties in this oil, so that's why they include it in the emotional pain. But really, frankincense can be in every category that we're talking about today, right? It is pretty powerful stuff. So know that there are oils and supplements to help you deal with the emotional pain that we experience in life as well. Now let's move on to digestive pain. 70% of Americans suffer with digestive pain, so it's a big problem. What kind of products do they use? Pepto-Bismol, that icky pink stuff, Mucinex, what else? I'm sure you guys are coming up with things in your mind, right? Well, let's ditch all that stuff because we have better stuff, particularly DigestZen oils. Probably the first thing that you thought of when I mentioned digestive pain. But we have more, okay? The Terrazyme is a digestive enzyme, so it helps break down your food so that you can absorb nutrients, but then eliminate waste product as well. I take 2 of those at nighttime, and I am regular in the morning, and I love it. We also have a brand new PB Assist Gut Complex, and that's to target your gut microbiome. It comes in a sachet. It tastes really good. It's kid approved and it works. Then, of course, you see the DigestZen oil, and then we have Tamer, which is the roller. That's the children's blend. What makes that blend so special is that it has the Japanese peppermint in it, and it's very, very effective with babies. So if they have colic or any kind of digestive constipation, just roll a little bit around their belly button, rub that in, and rub some on the bottom of their feet, press their feet a little bit, and in no time at all, you'll have a happy baby and a happy mama. And then we have our peppermint soft gel that is enteric coated. So what that means is when you swallow it, it'll go through your stomach, but then it will actually dissolve the real peppermint oil in your small intestines, in your lower gut organs, and it will help cut down the bloating, the flatulence, and it is recommended by Dr. Riggs to take a few of those before you undergo the procedure colonoscopies, because those aren't comfortable, right? But sometimes they're necessary. Well, they have done studies that have helped them to see people who take that before that procedure are much more comfortable, experience less pain, and are able to deal with that whole procedure and be much more comfortable. So, anyone have any thoughts about these products, stories that you want to share about digestive pain, or questions at this point?
I would like to say something.
Okay.
Okay. I think I've been taking them now for maybe 2.5 months. I'm guessing it's the Terrazyme, the PB Assist, and a few other ones. I can't recall them offhand. But before I started taking them, my digestive system was absolutely messed up. I have been in Metro and had to go to fainted, passed out because of my digestive system. When I have to go, I'm always in pain and it's so excruciating that I faint. I've been in the store with my husband. He said, now stay by me because I'll look up in the ambulance be here and it'll be you that they bring it out. I went to the International in South Africa. At Bethel, they had to call 911, which they have their own medical field. They had to take me in there. And it is my gut again, gut issue. So ever since I've been on the products with doTERRA, with the Terrazyme, the PB Assist, I have not had an ache. I have not had a cramp. I live by them. So all my friends that I have signed up under me, I'm like, it works. So for me, it's a lifelong thing now.
Yay! See, we love hearing those success stories. And you have to share that more and more because so many people are suffering and they can make those changes to improve their life on so many levels, right? So when it comes to our microbiome system, I'm sure you've heard that term or have heard doTERRA's education on our microbiomes. It's all connected from head to toe, right? But there is a special gut-brain axis. So we need to pay attention to our digestive system since we have such exposure to toxins through food, through the air, and chemicals and multiple things. Our newest gut probiome product is amazing. There is a course that you can take on doTERRA about that as well. But that product helps with your entire microbiome system. And this PB Assist really does focus on just the gut microbiome. So you can take both, or you could edit how you take it, depending upon your own health and your own circumstances. But these products are fantastic. They've helped so many people, and we definitely do need to share them more. Now, here's our last category, head tension. Head tension, migraines. Do you suffer from those? I have only had a migraine maybe 2 or 3 times in my life, but I do get tension headaches often, maybe like once every other week. And when I feel a tension headache coming on, I notice that my jaw is almost locked. My shoulders feel like they're up and around my ears. So the first thing I do is kind of try to check in with my body, relax my shoulders, open my jaw, maybe kind of clench drink some water, and then I start applying my oils. Frankincense is always my go-to. I put 2 drops underneath my tongue because it affects the brain. It crosses the blood-brain barrier. And then I use past tense. Past tense is very, very strong for headaches. I put it on the back of my hairline. I put it on my temples and I smell it. The 2 oils that I love in that blend are cilantro, and I think coriander's in it, or is it cilantro and wintergreen? I can't remember. But the smell alone can wipe a headache out. And then when you apply it on your body, there's this tingling sensation. It increases blood flow. And so they are pretty powerful. And then, of course, they recommend Copaiba soft gels because Copaiba affects every system in the body and helps it come into balance quickly. So you will be targeting headaches or migraines with internal supplements and topical oils. It needs to be dealt with those 2 ways. Migraines are pretty powerful things, but it also recommends eucalyptus oil. So why do you think eucalyptus oil is put into this category? Somebody, anybody, unmute yourself.
Well, I think because it is strong, even though it has a strong scent, it's very penetrating. Like
Uh-huh.
it really reaches inside your skin and I mean, just putting it on, you can feel it already. It's like a warming sensation to it as well,
Yeah,
I think.
yeah. Yeah, that's true. It has a warming sensation to it, but when you smell it, it usually goes upwards. You know, some oils go down, but eucalyptus usually goes up, and it's because it oxygenates the brain very, very quickly. So it can literally pull somebody out of a seizure. 2 oils that are recommended for that issue is frankincense and eucalyptus. Just smelling it opens up your brain, oxygenates it, and will cut down on the headache very, very fast. The tingling sensation adds a beautiful sensation that can help you relax and also take care of the headaches and the migraines. So those are our 5 categories that we talked about. Those are all the products that we mentioned in this class. I truly hope that you learned something new and you will experiment with some of these oils and supplements that you have to help you manage your pain and to help you feel confident enough to share these with other people. So we're going to wrap it up with just one brief quote from Greg Cook, who is an executive founder here at doTERRA. He said, "When you share doTERRA products, you bring hope and wellness to the people you love, your community, and ultimately the world. Selling the doTERRA way is about service, 1 drop at a time and 1 person at a time. We're serving the world with wellness solutions. doTERRA has so much to offer. Everybody needs doTERRA in their home." So thank you for attending today. I hope you learned something new, and follow me on Instagram at dream_manifest_grow. Let's stay connected there for future classes so we can all inspire one another to continue creating our healthy lifestyle. Okay, we're going to open it up now for a discussion, and I'm going to check that chat box because I saw it exploding. Carla, did you want to say anything else? Oh, Ariel, you dropped, "I've been wanting to learn how to deal with nerve pain." That's pretty serious stuff, right? That's deep. Nerve pain the Aroma Touch technique and that Symphony of the Cells can help with that as well. But the biggest oil, or the first oil that comes to my mind, would be Aroma Touch and Cypress to help you deal with nerve pain. Melissa, I see your comment. My pain comes and goes. I appreciate you dropping that in there. Deep blue capsules. Yep, and Copaiba. Uh-huh. Thanks, Jenny, for answering that question. Lavender and balance were the two oils in the Aroma Touch technique. Thanks, Wendy, for giving your personal experience. Oh yeah, acid reflux. Shay mentioned in the chat. Acid reflux. Okay, extremely informative. Any suggestions for chronic pain? I hope you took a picture of that slide. And Wendy had to go because she had another class. Okay, Ariel, go ahead and Adinla.
Hi,
Adeline,
who's going first? Hi, I'm Adelina. How are you guys?
good, welcome.
Thank you. So I am fairly new to doTERRA. These classes are amazing and mind-blowing. I am taking all the supplements that you named. Kudos. But I have a question. I put it in the chat, but I take magnesium. So I'm super low on two things. I'm in remission from cancer. And so my body's in its healing phase. Two of the things that I have to work on are my magnesium intake and my vitamin D. Any suggestions?
First off, Epsom salt foot baths and Epsom salt baths. That will help your body absorb more magnesium, plus it will be very, very comforting and relaxing.
Oh, awesome. Okay.
Pretty easy to do as well. And then vitamin D. I don't know where you live. Where do you live?
New York.
Okay, I was gonna say.
Don't even say it.
Don't even say it. I know. Well, you know what I was gonna say. Get it through the sunshine, right? Sit out
Sure.
in the sunshine as much as possible. Red light therapy is a substitute for that. Or
Okay.
blue light therapy, you could research that. Our bodies respond differently to the light, right? So there are products that you could use to illuminate different colors. Color therapy can help when it comes to the vitamin D issue. Are you taking any supplements for that too?
I am. I have to take my monthly supplement, Boniva, once a month. I also at times have to get injections because it's gotten so bad. The same with my magnesium, which I pass out from my migraines and wind up in the hospital for days at a time because I lose all the potassium in my body. So this is life-changing, kind of finding alternative natural healing. I've always used oils, but not in this manner. I've always used them through spiritual healing. So I loved your name, the dream underscore manifest, kind of goes with my vibe as well.
Good.
So I use them on a spiritual healing kind of journey. I never thought of it from an intake and using the variety of oils that doTERRA has available.
Okay, so if you're new to this journey, then just know it will take time. It's a personal experience kind of a thing. So the more success that you have when you use an oil or a product, the more your belief system is going to go up, right? And then the more you're going to want to experiment with increasing the dosages and the frequency.
Okay.
Okay. So if you're in remission and you're healing from cancer, congratulations. That's great. We love
Thank you.
kinds of things. You're welcome. But just know that it's going to take time. You have to be patient and continue to experiment with the product because your body is very different than every other body, right?
Yes, yes. And I do realize that there are a lot of things now that I cannot take because as a result, I'm now diagnosed with Hashimoto's disease. So there are a lot of things that I cannot take for the Hashimoto's because of the cancer. And because it happened before I was 50, that made it completely different. So I have to learn my body, if that makes any sense. I have to now relearn my body and see what works for my body. But it's definitely a lot of the products. I definitely have so many testimonials to how they have helped, which is why I am now so vested in learning more and wanting to explore them.
Wonderful. Well, I hope to see you on more classes because at every class you do learn something a little bit new. I forgot to mention when it came to the digestive pain that people suffer,
Yes.
consider the fact, consider if you are missing an organ. Many
Yes.
people have their gallbladder removed, their appendix, their spleen. So they're minusing small organs that the doctors made them think isn't really important. We could just take it out, right? But it affects everything. It was put there.
Mhm.
And so when you minus an organ or when you add metal into your body,
Right.
that changes everything as well, because knee replacement, hip replacement, dental implants, all of those things edit how our bodies function, and so it will take us a little bit longer to see how we respond. Does that
Yes.
make sense?
Absolutely. Absolutely. I completely agree.
A couple years ago, I had 3 dental implants on my bottom jaw here, and I was determined to only use doTERRA oils. And I talked to my periodontist about it and I said, I don't really want to take this prescription or opiates. I just want to rely on my oils. And he said, oh, we use doTERRA here. That's fine. But just take the prescription and have it at home just in case you need to combine them. I was like, oh, thank you, Lord. Give me this kind doctor who knows that I can, mix the two if I need it. And sure enough, I did my research and I applied oils and I took extra stuff before I had the surgery. And then when I came home, I iced for 24 hours and I followed all the instructions and I used all my oils topically, clove, Roman chamomile internally, gargled with On Guard. And I healed up so nicely that when I went back, he was like, I'm really impressed. And you didn't take any of the opiates? And I'm like, nope, I did it all. I used all the heavy hitters. I was like, I've got all these expensive oils, rose, helichrysum, I put all the heavy hitters. I was like, I am worth it. I am worth every penny of oils. And sure enough, it worked. But I did have a little bit of a doubt, right? I was like, I hope this works. But I
Yeah.
know I have this. But that whole experience totally helped me believe and solidify my belief in the fact that my body was created with these wonderful healing mechanisms. I just need to give it the right thing. I
Right.
need to take the time to find out what it is that it needs, and then it will kick in and work properly, right?
Yeah, that's the journey that I'm on now, learning which oils work best for me, which ones, and even with my LLV, like some of them, as opposed to taking them in the morning, I realized that I'm better off taking it at night. So I'm kind of playing with it right now,
Yeah.
to see how my body reacts.
Yeah, that's good. Yeah, that's good. Like I said, that takes time. That
Yes.
takes Sometimes people have to actually document things, right? They keep a little journal by their bed. They say success. No, it didn't work very good. It works better in the morning or at nighttime.
Yeah.
So I'm glad that you're having success. Thank you so much for sharing. I wish,
Thank you. You guys are amazing.
thank you. All right, everybody, that's our time for today. Happy Sunday again. I hope you enjoy the rest of your evening. Follow me on Instagram to hear about all the other classes. I'm here every Friday at 3 p.m. teaching another continuing education class. So I hope to see you then. Bye-bye.